Welcome back. So today I have a meeting with one of my clients. Her name is Sam. So I've been working with Sam for the past 4 months now, and I've been case managing her for about every other week. And last time that we spoke, Sam told me that they had been hearing some voices. They are currently working right now, and so they were saying that they first started hearing them whenever they started working, and they didn't really know if that was a coworker that was trying to talk to them, or if they were kind of just hearing things. And so that was really the last time that we spoke, and so today's just a follow-up just to see how Sam has been doing. So Sam, thank you for coming. It's always a pleasure seeing you. So what's been going on since the last time we've spoke?
Not much. I recently was admitted to Mayhill, so I've been there for a while, and they tried to put me on a new medication, but the new medication kind of makes me shake.
Mm-hmm.
So I try not to take it, but then I kind of get in trouble for not taking it. So
Right.
I'm kind of not really wanting to, but kind of having to.
Okay. If you don't mind me asking, what brought you to going to Mayhill?
After I went to see my psychiatrist the first time before they took me to Mayhill, I had told them that I was hearing voices like you had previously said at work, and that maybe my medicine wasn't working.
Uh-huh. Was this for your regular psychiatric visits? For like your med refills? Is that why you went to go see your psychiatrist?
Yeah.
Or what did you?
Yeah, so I could get it like up or lower, just because while at work I kept going like, what, like, huh? And they were like, what do you? I was like, why are you guys talking? They're like, we haven't said anything. I was like, I swear, like, you're talking to me. And they're like, no. So
Right.
I went to tell them that maybe it was, my medicine, and I was taking it like when I had to, and there was nothing wrong with that. They just upped it, I wanted them to increase the dose.
Mm-hmm.
And when I went, I was telling them that I was hearing more voices than usual. Like, I was good for a minute because I hadn't heard them in a while, but
That's good.
after the work incident, it just came back more often.
Mm-hmm.
So I was trying to let them know about that, and then I don't know if maybe like they got worried or something that they stepped out for a second, and they were talking in the hallway, but it sounded like there was talking in the room, and they just amplified, and I felt like the room just kept talking to me, and like there was voices everywhere, and I guess I had a freak out, or I don't really know what happened. I just know that I was at Mayhill and I was getting on other meds, so here I am now. So.
Yeah, well, that sounds like a lot.
Yeah. Isn't it?
Right. So basically, what I'm hearing you say is that since you last were at work, you started hearing those voices, and so you went to the psychiatrist to follow up on your med refills, but also to just let them know, hey, like, this is going on, and so from there you started hearing voices again, and the next thing you know, you're at Mayhill.
Mm-hmm.
Okay. Well, that must be really, traumatizing. Just, just the fact that, this is happening all of a sudden, since you said, you were good and you were feeling better now. It's happening out of the blue, and, you went to go seek help, and the next thing you know, you're at, Mayhill, and then now you're here. Well, first off, I want to say thank you for coming, because I know that despite everything, I know it can be very overwhelming, and it's definitely really hard to seek help, especially whenever you're constantly in the process of battling different things every day. I know that you are one of my more I don't want to say easier clients, but you definitely have just a willingness to want to be able to be as independent as possible, and I really, I just think that's a really good characteristic that you have. I know whenever you're dealing with just mental health, it can get very overwhelming, and especially whenever you think you've conquered or battled something and it happens again, it can just get really, overwhelming, and you're just like, what the heck. So if you don't mind me asking, if you remember anything from being at Mayhill, what was your brief experience there? How long were you there?
I didn't hurt anybody, thankfully, so they didn't keep me there for long. But I guess I wasn't being responsive to, like, I guess calming down or something. I'm not sure. They had to sedate me. I'm legally, like, on my own. For a while, my mom was taking care of me, but there was, like, conditions I had to meet to be able to, like, live on my own.
Right.
And that was, like, taking medication frequently, as I needed or whatever.
Right.
I had to see my psychiatrist often and so on and so forth. Keep a job, like, just pretty much being clear which I was. So after that happened, they notified my mom, and she came down, and she's like my emergency contact, so I don't mind that at all.
That's good.
So I trust her, and she just kind of was like, "Are you not taking medicine?" So it kind of felt like they thought I wasn't doing what I needed to do. And maybe I slipped up one time. I honestly don't remember. But they only kept me there for like about a week to just make sure it wasn't like the medication, but they also wanted to see how I react to the medication, like the new one they gave me.
Okay.
I didn't start like the shakes until maybe 2 weeks into the medication.
Okay, so you noticed a change, but not. Did you notice, other than the shaking, did you notice any other effects to the medication as far as like it serving a positive influence, or is it more so you just notice that?
I mean, I guess it's working because I sleep more now, so I don't hear the voices while I'm sleeping.
Yeah. How often do you sleep, if you don't mind me asking?
Well, with the new medicine, I've been sleeping from like, it could be from like 2 in the morning to 2 in the afternoon, and you know, it's not bad because I'm still like, I still have pretty much all day to go to like work, whatever. But I've been trying to take like the later shifts just because I can at least tire myself out or get close to being tired by the time I am going to go to sleep, and then go to sleep and wake up.
Right. Well, I definitely wish I had the time to sleep as long as you do. I'm very jealous of that. But, you know, that makes sense. Whenever you add any kind of new chemical or substance in your body that your body's not used to, it tends to have different reactions. I know some of them cause, you know, drowsiness or sleepiness. So I'm glad you're sleeping, but, you know, it's also good to keep in mind that nothing in excess is good, even if something simple as drinking water. So, you know, I definitely think it's good that, you know, you're continuing to take your medications. And whenever you do see your psychiatrist, just keep them updated and let them know, hey, you know, I noticed once I took this new medication, it was making me shake more. So we definitely want to, you know, reduce as much negative effects and just try to keep everything as leveled as possible and make sure that you're feeling good, and that you're not just kind of, you know, zoned out and just kind of taking medications because they say you need to. At the end of the day, you're the expert in your situation, and if you don't feel good, then, you know, voice your concerns. And if you feel like your physicians or just anyone is not hearing you out, then just know that you have that ability to go and seek someone else who will understand you and help you in the best way that you feel you should be helped. So as far as schizophrenia, I do know that it is one of those mental health problems that unfortunately is forever. However, we can control how we live with that. And so I know that treatment does conclude of a lot of working with a lot of helping professionals, like I previously mentioned, whether that be your psychiatrist, social workers, your co-workers, since you mentioned that you work.
My coworkers don't know that I have schizophrenia. The only one that knows are my managers, the 2 that I have. It's never really turned out good when people find out that I have schizophrenia. At least, like, peer-wise, I usually say something and then it kind of becomes like a joke, or it kind of becomes I'm like their expertise. I'm like, oh, how does that feel like? And it's just, it gets overwhelming just because sometimes I don't understand half the stuff that I'm thinking, or maybe not necessarily thinking, but like hearing at the same time, and it just becomes a lot of information or a lot of things that I have to rely that I just want to go and work, and you know, so I let my manager know, just because of course if anything were to happen at work, or I want them to know that maybe I may not come into work sometimes because I cannot just something is telling me do not go outside. So you know, but as far as like my coworkers, they just think that they think I'm funny. And I think it's just because I'm sometimes here, sometimes not here. And, you know, sometimes I'll say stuff and they're like, what? And I'm like, oh, I was talking to myself or whatever.
Exactly. So. And I definitely agree with you 100%. As far as your privacy, that is up to you, whether who you want to disclose that with. I just do encourage that you don't necessarily have to tell your boss or your manager that you are, you know, having to deal with this, essentially, but just letting them know and saying, hey, if for whatever reason I miss work and I don't answer, then be worried, you know, or, you know, just so they can kind of, you know, just so you can have those checks and balances, you know, and just as you're responsible for your half of, you know, taking your medications, going to your appointments, you know, helping your other support systems keep you in check so you can stay, you know, the best you as possible.
And they have my mom's number just in case I don't answer, so they'll call her, and usually if that happens, she knows either what she needs to do, and they're like, oh, don't worry, like she'll be there in an hour or so, and she'll come find me and, you know, help me on it. If I can't, then she'll let them know, like, you know what, you know, she'll be there tomorrow, she can make up hours, or and then I end up talking to them like, oh, you know, whatever.
Well, that's good that
oh, ew.